Hi, Teresa Duncan here with Odyssey Management, and behind me is my very hardworking mascot, Griffin. You can see this day has just been exhausting for him. So I wanted to talk to you today about using third-party financing with your in-house savings plan. This is a question that comes up all of the time in my classes, and so I figured let me go ahead and put this on video so that you can show it to anybody else in your office who may need some guidance or has some questions. It's a very, very common question. So the way typically in-house savings plans will be structured such as they pay a certain amount to join your savings club per year, and they receive, certain procedures complimentary, such as, maybe your diagnostic or preventive services. And then they will receive typically a courtesy off of the remainder. So maybe major and basic may have a straight 10 to 15% courtesy that they'll give. Now, what's the problem with that is that sometimes I'll see up to 20%, and that's pretty high. I really would not recommend going higher than 15% so that it gives you a little bit of wiggle room. So when you have somebody who comes in and they purchase this type of plan, well, it's great for them because they don't have coverage and they still have access to get the care that they need, but it's still a pretty large amount. So what I want you to think about is continuing to include third-party financing along with the in-house savings plans. So say your third-party financing has a percentage rate of 9% or 11%, whatever it is that you do. Well, you're already giving that amount as a cost of doing business. That's what you signed up for, and I understand sometimes it feels like it's a lot, but it's really not. It's the cost of doing business. So what I would have you think about is when you're participating with a plan, typically you're writing off, I know sometimes it says 20%, but it's usually maybe closer to 40%. And in some cases, I've seen even higher than that. So if you offer a 15% courtesy off of your services in your in-house savings plan, that extra 10% it costs to finance the rest of the care is really even less. It's still going to be less than the cost of participating. And if the third-party financing helps them get to the yes, I'm always about moving your patients to yes. If it helps them get to the yes, then why wouldn't you do that? So our patients are already committed to coming to us. Think about this. They're already committed to coming to us. They're willing to pay an extra amount out of pocket to be in a loyalty program to your practice. That last hurdle of getting all of the work done shouldn't be that difficult. Why not utilize the third-party financing that you're okay with already for other patients? Why not utilize that for your in-house savings plan? Now, you can always, of course, decide on which setup, which plan length that you'd want to go with. Talk to your third-party financing company. I know a lot of offices that I work with, they know their care credit rep by name and they know how to pick up the phone and call them. If you don't, I urge you to become one of those practices. Give a call to the main number, ask who your rep is, and ask for a lunch and learn. Ask them to stop by the office and introduce themselves to you. There's a lot of online tools that they have for you, calculators and that sort of thing, that can help you figure out, along with the patient, how to finance the cost of their care. They're already committed to coming to you. They're already part of your loyalty plan. Let's finish that last step. Let's help them finish that last step to get to the treatment that they so need. And of course, they're coming to you for it, so they already trust you. So again, let me just sum up. The question that I get all the time is, I'm already giving a courtesy for an in-house savings club in my office. If I give them an extra amount because of third-party financing, I feel like I'm losing money on that. I want you to flip that around. Had you been participating, you would have lost a lot more. And if you don't offer third-party financing, you don't know how much production you're losing because patients are not moving forward with it. We can track it on our treatment trackers all we want, but you cannot track the amount of people who silently decide right in front of you, I can't afford this. That's why we give them all of these options. So if you have any questions, give me a call. Contact your third-party financing company if you have any questions on how it works for your office. And hopefully we can get more of our patients to yes and get the treatment done. Thank you so much.